hear you. Bismillah ar-Rahman ar-Rahim. Dear all participants and SESME member, Assalamu alaikum. And very warm welcome to this session webinar series arranged by Saudi Society for Medical Education, Riyadh office. I'm Dr. Shazi Iqbal, head of CPD activities and chairperson for continued professional development activities at Saudi Medical Education Society. So you know that with advancement in technology, a lot of things are abruptly changing, and especially during COVID periods, there was a lot of dramatic changes in medical education, health profession education, and health sector itself. And telemedicine is one of them. So today's topic is very exciting, that what is role of telemedicine in for health professional educators especially. So we shall seek and learn with experience of our eminent speaker, and I'm very much delighted to introduce our eminent speaker, Dr. Iffat Zafar. Very warm welcome, Dr. Iffat, to SESME Riyadh office. And Dr. Iffat is co-founder and chief operating officer for Sehat Kahani, which is a telemedicine organization, startup based in Pakistan. She did her medicine from Ziauddin Medical University and did her MSc in Global E-Health from University of Edinburgh. She is a Commonwealth Scholar and she's winner of Healthcare Award given at the World Health Summit in 2022. She is winner of many other awards, including TAI Singapore Women Global Competition, winner of GBP Health, Future United Provocation Award. And apart from that, she is very active in establishing telemedicine in the region. So it will be a good opportunity for us, for medical educators, to learn from her experiences and to know more about telemedicine and how we can establish it at medical schools or how we can establish it at healthcare sectors in our region. So very warm welcome, Dr. Iffat, and now it's over to you. I hope you can share your screen now.
Yeah. First of all, Assalamu alaikum, and thank you so much for joining. And thank you so much for such a warm introduction. As you introduced, my name is Dr. Iffat Zafar Agha. I'm a medical doctor and a professional based out of Pakistan. And my work revolves around creating an organization which is focused on telemedicine. So I'll talk about two things. I'll give you a brief introduction about the organization, what it does, what we've done so far. And a very important component that being a telemedicine company, we started working on and we created was creating an online learning module or an online learning platform. I think that, and in my experience, post-COVID, especially for physicians, this has become a really valuable tool. So just give me a minute. I'm just going to share my screen and I should be able to walk you all with it. So we'll try to keep the presentation short. I'll try to finish it within 30 minutes so that there's ample opportunity for everyone to ask questions.
Sure.
So can you all see the screen?
Yes, we can see your screen, but you can put it on full screen. Yeah, that's perfect.
Yeah. So I think quickly briefing here, the name of the organization that I am representing today is called Sehat Kahani. Sehat Kahani essentially means story of health in Urdu. And, you know, really proud to share here that Sehat Kahani was the only company in 2022 which got mentioned in the 100 to watch companies by Forbes. So you know, I think very humble to share this with you. This is me and this is my co-founder. and we both have around 14 years plus experience of working in the digital health, the pharma sector, and community healthcare altogether. And I think I share a little journey here with you. How did we create Sehat Kahani? We both are female doctors, and somewhere in our journey, we realized that we had to choose between either having a career or having a family. Coming from a country which is majorly patriarchal, where everyone wants their women, their wives, their sisters to become doctors. But when it comes to practicing in real life, not all of them are fortunate enough to be able to be from supportive families who would let them continue this. So a lot of these women ultimately drop out. Now, what happens out of this missing doctors phenomena is that we are the 5th largest country in terms of population. We have around 220 million plus people in our country. We have around 245,000 registered doctors. You would think that, okay, this is such a good number. Well, what is the challenge then? So the challenge is that more than 80% of this number is made up of female doctors, but unfortunately, they don't work. There is a very interesting term in Pakistan, which is called the doctor bride phenomena, where people want their wives, their sisters to become a doctor. And the reason for that is it brings a lot of prestige, it brings a lot of respect to their household. But when it comes to them working, we don't have a lot of daycare facilities. A lot of families don't really support women working. So ultimately, the result is a lot of them drop out. Out of this number, only 40% ever come back to practicing. There's another 15% of physicians who leave Pakistan for better work opportunities outside in the global world. In fact, if you ask me today, given the situations that unfortunately Pakistan is facing, I'm very confident that this number has actually risen to 22, 25%. So a large number of doctors leave Pakistan. As a result, we only have 0.5 doctors for the population, that for 1,000 patients. But while there are challenges, there are opportunities also. So while we saw that there's this challenge, the opportunity that we foresaw was that the penetration of smartphones, internet, connectivity grew exponentially in the last few years in Pakistan. We also created a market valuation. So the total addressable market that we feel right now, which could be catered through telemedicine, actually is a good 51 billion US dollar market. This is a calculation that we made based on the top 7 to 8 ailments for which people go to a doctor, people access healthcare facilities. So in a crux, Sehat Kahani is a digital healthcare platform that connects patients in need of quality care to doctors via affordable, convenient, and easily accessible technology. This is the kind of team that works with us. So as you may see, it's majorly made up of young individuals, dynamics, who have grown with us in the organization. So what does Sehat Kahani do? Sehat Kahani enables healthcare access using telemedicine. In 2017, we started the organization by creating a network of nurse-assisted e-health clinics, the one which you can see on your extreme right, or maybe left, the e-health clinics. We would go into communities, we would identify a 2-room space where there would be nurses present. And what we would do is that we would give them access to our software through which patients who are walking into that clinic would be able to access qualified MBBS doctors. In 2019, we realized that it's not just the community who needs access to healthcare, but it's also people like you and me, people who are based out of the cities, who need access to a doctor. Maybe the pain points for us might be different, but the challenge is there. So for example, for me, maybe cost is not the major concern, but access is. Living in a city like Karachi, which is heavily populated, which has a lot of traffic issues, going to a doctor would mean my entire day is lost. That's when we came up with the retail and the corporate application, which allows individuals access to a physician 24/7, no matter where they're based out of, just from their smartphone. I think what made us a good success story out of Pakistan was that we are 2 doctors who created a tech company So more than tech, we were very familiar with what the patients needed. We created a multi-population focused solution. So it's not just for the urban population, it's not just for the smartphone users, but it's very much for the low income or rural populations as well. Pakistan is a country where 64% of our population is based out of the rural areas. We also understood that, patient is above all. So we would always create strategies which would really facilitate a patient. For example, along with access to a doctor, we also created a 24/7 helpline. Now the helpline also has a medical helpline. So for those people who may not have a smartphone, they could access a doctor from their feature phone. And for those people who, for example, are having a challenge in accessing a doctor, connecting to a doctor, or maybe, any glitch with the technology, they can just call up on that helpline that will help them connect to a doctor. And I think in our journey, doctors are very important. And I think why it becomes very relevant to all of you is that the beauty of telemedicine is that a geographical boundary does not need to be maintained anymore. So very interestingly, and I'll talk about that in the next slide, we have a network of 7,500 doctors. A good 19 to 20% of these doctors are based out of Pakistan. And they are Pakistani nationals, but who are living in other parts of the world. And they're still able to give back to Pakistan. The exciting thing is that these doctors are actually able to make the same amount of money, almost approximately the same, that they would have been making in a physical setting in Pakistan. Where are we today? We started the company, as I mentioned, 5 years ago. Today, we have a network of 49 e-health centers spread all across Pakistan in all the provinces, including Kashmir. We are working with 5 insurance companies, with the support of which more than 600 plus companies have now access to our services. For our application, we have 1.1 million downloads. Collectively, we have done around 1.8 million consultations through all of these platforms. And these are some of the names, some of the companies which are using it. So people who may be familiar with Pakistan, HBL, Mizan, Faisal, these are one of the biggest banks in Pakistan. Even in the global sector, if you look at it, Coca-Cola Pakistan is using our services, Unilever is using our services, Engro is using our services. Now let me come to the training bit. And when we entered into the COVID era, a challenge that we realized was that a lot of these physicians needed to be trained time and again, continuously, for being able to consult people in a virtual manner. Having a look at this, what we created was an entire MLE department, monitoring, learning, and evaluation department. Since we're more focused on the education bit, I'll majorly talk about that only. But our MLE department has 2 functions. We ensure that all of the consultations that are happening, whether it's a clinic, whether it's the community, any other place, whether it's the application, the corporate, all the patients are given a feedback call. So that feedback call data is recorded, and then that is audited. We also make sure that all the data is audited on a regular basis. So we take spot checks of the data after masking the patient's identities, just to evaluate that the kind of treatment that was given to these patients based on their condition and the complaint and their prospective diagnosis was correct. So when we created the CME, or the online learning program for our physicians, the vision was that these are a lot of doctors who are based all across the world. They need to be trained to the most recent protocols continuously. They need to be connected, and they need to be engaged constantly. So the first thing that we did was we created an online learning management platform, an online tool which is owned by Sehat Kahani. So any doctor who joins in Sehat Kahani, if they're a general physician, they have to go through that OLP system. It has around 20 courses for the key ailments for which we have seen patients come into the Sehat Kahani clinics, or they have consulted through the application. Once they go through those courses, then they have a quiz. If they're unable to score 75% or above, they won't be made to consult. They will undergo the quiz again till they've scored a certain number. The reason we created this was that, see, Pakistan is a country which doesn't have a lot of regulations. When we started working, there were no telemedicine-based regulations. So we had to make sure that we were able to create the right kind of regulations and the guidelines, which would ensure our doctors are following the right medical protocols. So this is how we started creating that program. We have done around 85 CMEs till date. We have created partnership with around 6 organizations, which I'll talk about in a bit, who have facilitated us in training this network of doctors. Almost 6,000 of our doctors have been trained. These are some of the organizations with whom we have partnered to create training programs. So Khan is one. Khan University started creating a virtual family medicine program, which was for physicians who were either coming back after a break or who wanted to practice through telemedicine. Now Ziauddin also has created a similar program, and we have just partnered with them. Their logo is not here, but just mentioning it there. Health Services Academy is a national institute in Islamabad, which is a part of the government institute. We have collaborated with them. We have done online programs with them. UNDP, USAID, IPAS, and World Health Organization. We have done a lot of virtual trainings with these 4 organizations, especially during the COVID era. So whether it was pertaining to the most recent COVID guidelines, managing COVID patients at home, when do you refer COVID patients, mental health, a lot of these trainings were facilitated by these 4 organizations with whom we have worked during COVID. I think one more learning that we realized, and I think a lot of Pakistani organizations or institutes also realized during the COVID, was that before that, a lot of these trainings used to be physical. The challenge with physical trainings is that a lot of people can't attend. I think the beauty that we saw in our partnership with WHO or UNDP was that they really promoted virtual training programs, which were the most relevant for physicians who were practicing also using telemedicine. So this is some of the work that we did during telemedicine. I think I already talked about the online learning management system. This is how we have created the OLP tool. It has different virtual courses. The people or the doctors, as well as the nurses, can access those courses. After they've gone through it, they can self-evaluate themselves. They can also do a quiz. The overall vision of this entire division is improving the overall quality of care, evidence-based medical training to physicians to improve competence, stay up to date with the latest developments in medicine, meet licensing requirements, and gain professional growth. So for example, now we're also looking at different accreditations. Last year, we were able to get ISO certification. This year, we're also looking at how we can attain JCI certification. It is a big ask, but this is something that we are looking to do. We also want to make sure that we are able to address real world challenges that physicians face every day, especially if they work virtually. These are some of the topics that we have, covered during our trainings for our doctors who are working virtually. So a lot of, the main medical crux, which essentially these doctors can practice using telemedicine. Normally, how we do is that we do 2 CMEs per month. They create a calendar, which is regularly updated by our MLE manager. We keep on changing the speakers. So I don't know if Dr. Faisal is here in the session, but I am a Ziauddin alumni, and I keep on asking different Ziauddin doctors to give CMEs and trainings on different topics, which has really helped in my experience. We also do a lot of such virtual trainings for nurses as well, because when you talk about telemedicine, it's not only the doctor's role. In our part of the world, as I already mentioned earlier as well, in the clinical setting, it's not just the doctor who's practicing, but there's a nurse intermediary who facilitates these consultations. So these nursing trainings are also very important. In fact, just today and tomorrow also, we are having our annual nurses training. And we also do pre and post surveys to understand their overall knowledge increase, which really helps us ultimately in making better and better training programs for them. So this is how we have worked around in the last few years in the area of telemedicine, and how we have created virtual training programs to maximize practice through telemedicine for the physicians as well as the nurses. And I think I'm open to any questions that anyone may have.
Thank you so much, Dr. Ifat, for this wonderful journey, the way you have taken us. And it's really amazing job which you are doing in establishing this telemedicine in the region. So in our participants, if you have any comments or questions or queries, or anyone interested more to know about telemedicine, please feel free to ask question. So meanwhile, Dr. Ifat,
In fact, I was just trying to pull up a video. I was just trying to pull up a video.
Okay.
If I could play that as well. So there's a very interesting documentary that we recently got made in one of our Kashmir clinics. And let me see if I could just pull it up. In the meantime, you were asking me something.
All right. Yes, Dr. Faisal, if you want to ask something.
Yes, Dr. Ifat, thank you very much for your detailed briefing about the telemedicine, the platform you have created. Could you please enlighten us that how could we make changes in our medical education to produce doctors which can help and which can accommodate, can be accommodated in this telemedicine? And what should we need to do at the level of the students to help this kind of things to go out?
I think, and my degree is, my graduation is actually in global e-health from University of Edinburgh. So I think one thing that I feel a lot of institutes need to really start doing for their undergrad students is a basic introduction to telemedicine. What is telemedicine? How is it different? What are the different kind of licenses? I understand that maybe the telemedicine or the health policy protocols in Pakistan might not be so developed, but I feel that in Saudi Arabia, particularly, there's a lot that can be trained. For example, during my master's, they made us dissect the digital healthcare policy of developing countries such as Kenya. And that was so exciting to do because we not only got to see and learn what were the digital policies that different countries had all over the world, but also how were they scaling up telemedicine and digital health with their various other healthcare interventions. So I think a basic introduction to telemedicine is something that I feel is a mandatory thing. Every institute should add it. I'm trying to, honestly, I'm after Ziauddin and so many other institutes in Karachi also to add it. The second thing which I feel needs to be done, especially during house job, is how do you practice using telemedicine? And I think a very interesting thing is that when you become a doctor, a lot of our training does not involve communication with the patients. Bedside manners is a part of it, but it's also very physical. So when you become online, how do you make sure that the patients are really motivated? How do you make sure patients feel valued and they feel that they're treated? So one thing which we also train our doctors is how can they practice? How can they really enhance their practice? So for example, some very basic measures, they have to wear a lab coat, they have to have enough substantial light behind them so that they're easily visible. They need to really listen to the patients. They really need to, in our criteria, very honestly, for example, if some doctor does a consultation which is less than 4 minutes, we don't pay them. So to that extent, I think how do you practice different healthcare ailments through telemedicine is something which should be a part of different curriculums as well.
All right. So, yes, Dr. Leonidas.
Yeah, thank you very much for the presentation. It has been marvelous in all sorts of ways, considering the path that you have covered so far. What I actually wanted to ask is, I actually have two questions. One is regarding the protocols that you have indicated in the first part, basically that information aggregated on your software is majorly presented as protocols to guide physicians to make better decisions. And considering the fact that some of your customers and physicians are operating outside of Pakistan in countries where there may be more strict regulations in terms of practicing medicine, I'm just curious, how's that working? Basically, if compliance is being considered for physicians who are working outside of the country.
Yeah. So very, very interesting question. And we are working on a regional scale as well. So one thing which is really important is, for example, if we plan to scale into the UAE region or the MENA region, the company has to have a license of that respective geography. Similarly, all the doctors need to have a license of that specific geography. Even for example, in Pakistan, when we are working, even if there's a Pakistani doctor who's based in the diaspora and their PMDC license, which is the Pakistan Medical and Dental License, is not up to date, they can't practice. So taking in account all the different licenses. One more interesting thing that we have seen is the language. The language is very important. The doctors and the main team need to know the language of that respective country. Even within Pakistan, what we've seen is that in the geographies that we cater to, the patients need to communicate in a different language, and the doctor needs to know that language. In terms of maintaining good quality, this is a really good question that you asked. And that's why the video that I'll show it in a bit, what we have created is that we've created a patient decision-making tool. Now, what this decision-making tool does is that as a doctor, for example, if I'm consulting you right now, I would ask you questions based on your history. I would have a form open on my screen, which would divert me to the most probable diagnosis based on your answers. For example, I would ask you, do you have a chest pain? You would say yes or no. I would click no, then it would lead a couple of other questions. I would ask you those questions. This has brought in more uniformity in our practice. And we have essentially made all of these based on the NICE guidelines. So this has really helped our practitioners also bring in more authenticity, more transparency, and more uniformity in their practice.
Thank you very much for the answer. And the second question that I wanted to ask, it's quite a brief one. So what has been, I mean, your target is both patients and physicians, let's say. And as any innovation, you have the potential of some barriers because innovation is yet to be accepted. So I'm just curious, what side has been most reluctant in terms of integrating your software in their daily practice, whether those were physicians who were not used to practicing in an innovative way, or if there were patients who were more accustomed to a traditional way of seeing a doctor?
I think the most resistance that we have faced is usually from patients because they want to go to a physical space. But I think the setup that we have now worked out, where we create a telemedicine platform within a community nurses clinic only, has eliminated to a large extent. See, when we cater to a very low-income community, which is not literate substantially, for them, trusting a doctor who's just on your phone doesn't really make sense. They want that tangible feel. They want to walk into a space. They want to meet the person in real life. But the irony is these communities are so remote, doctors don't go there. So these communities already have a network of nurses, community health workers, midwives who are present, who are running clinics. So what we do is that we upgrade their own clinic and we add a telemedicine platform within their clinic, which allows them more authenticity in their practice. Because in Pakistan, a community health worker or lady health worker is not really allowed to do online OPD or any kind of OPD. She's only allowed to do maternity. With us adding an online doctor in their clinic, what happens is that now a patient can walk into their clinic. They, being nurses, can continue doing their maternity care, and they can liaison with that online doctor and help a patient speak to a doctor. So that really, brings in the trust factor. I think another challenge, for example, very recently that we are facing right now is, I think after the floods, internet has been a challenge in some areas. A lot of towers fell down. So despite the fact that the doctors are there, the nurses are there, the connectivity was not working. This was a challenge that we had. I don't think we've had other major pushbacks at the moment. I think COVID has really transitioned people's journey for digitization.
That's
Thank
great.
you very much.
I hope that answer to your question. Any other question? Similar to this question, Dr. Saleh, he has written in chat box for Dr. Ifat that what are the main challenges to face telemedicine at your institution, Dr. Ifat, and how did you solve them? I think mainly you covered these challenges, but I would say that, always whenever there is some change, especially with technology, there is a resistance by physicians, or you can say faculty to adopt it. So so how about those challenges that physicians, did they accept it easily, or they accepted it gradually, and did you do some kind of regular trainings with them? So if you can more highlight at this point.
I think more than patients, the doctors have been a challenge, yes. And I think I'm speaking to a group of doctors, but I think in Pakistan, and I'm sure in most parts of the world, unfortunately, doctors come with a lot of God phenomena. So I think that has been our challenge. The younger doctors have converted much easier to telemedicine. They're more easier to train. They're more tech savvy. They're excited about it. But doctors who have their practice set, who are more mature in terms of becoming very easily familiar with technology, we have had challenges with them. Another challenge that we've always faced, especially with more senior physicians, is that doctors have been very used to of having, that one assistant who's booking appointments for them, who's like managing the patients coming in, going out. When it's a virtual clinic, it's you yourself only. And they still either miss out, sometimes consultations. They're like, oh, no one reminded us. But we have to tell them, okay, no one had to remind you. You have it on your phone. The reminder's there. So I think these kind of small issues. So we resolved it by adding a person in the helpline whose job was to call, those senior specialists that, okay, in 10 minutes, your consultation is due, and so forth. But I think a lot of constant training is needed for different careers of doctors, different age groups of doctors. With the more younger physicians coming in, I think they're more adaptable to telemedicine.
That's great. So far, we don't have any question left in chat box, so you can play your video and we shall take more questions later on.
Yes. So it's a little documentary that we made. We partnered with the government of Kashmir, and what we did was...
Despite having a population of 220 million plus people, Pakistan only offers healthcare to 50% owing to the lack of physicians. Of the 245,000 licensed physicians in Pakistan, 80% are female. However, due to social and cultural reservations, only 40% of them practice medicine, and another 15% of physicians leave Pakistan for better work opportunities. Sehat Kahani, founded by the two female doctors, Dr. Sara Saeed Khurram and Dr. Ifat Zafar Aga, is Pakistan's leading digital healthcare company that has given access to quality and affordable healthcare service through user-focused ICT solutions implemented by a network of qualified female HCPs and specialists, and through a network of nurse-assisted e-health clinics in low-income communities. To date, through an extensive network of 7,500 plus female HCPs trained to continue their medical practice through telemedicine. We have enabled 48 nurse-partnered e-clinics to provide quality healthcare to people who had never seen a qualified doctor before. Our mobile app has a consumer interface with 1.15 million downloads and a corporate interface where we have a network of 600 plus corporations using our services. We have successfully conducted over 1.9 million active online consultations. Apart from the e-health clinics, which are already present in low-income settings, with many within humanitarian communities, a large number of our consultations come from Tier 3 and Tier 4 cities. We realize that scale can only happen with the support and partnership of the government. In order to cater to this, Sehat Kahani for the very first time created a public-private partnership with the IT Board of Azad Jammu and Kashmir, with which we established telemedicine platforms within 13 basic healthcare units. These telemedicine centers were equipped with the state-of-the-art technology, telemedicine software, and digital tools to make accurate diagnosis. To tackle the attrition of doctors and to enable healthcare to all at these clinics, Sehat Kahani encompassed the following components: integration of e-tools such as e-stethoscopes, ultrasound probes, e-glucometer, and e-blood pressure devices into these e-clinics enabled efficient diagnostics and seamless transition of data within our telemedicine setup. In these 13 BHUs, we have seen 4,307 plus patients so far, with a major focus on maternal and child health. Many of these patients had never seen a qualified physician in their life, owing to the remoteness of these clinics.
I'm Dr. Khalid Rafi. I'm Director General, AJK.
So I think this is, how it is a long video, but I think I just wanted to show you how, the community works and how it essentially the look and feel of the work. So yeah.
All right. Any other questions from participants? Please feel free to raise your hand and can ask your queries. Well, Dr. Ifat, I would be very much interested to know, when we talk about telemedicine, there are certain barriers or apprehensions, especially it's about security of data or breach. So was there any kind of incidents you faced regarding breach in security of patient privacy or patient data, or these are all potential complications? So I have no idea that in your long experience, if you have ever faced such situation, how did you deal with that situation?
So the good thing is that, alhamdulillah, we haven't faced any such situation. Our data is located on Azure. So we are partners with Microsoft. So all of our data is stored on their cloud. So Microsoft obviously guarantees a lot of security, encryption, and data protection. So that's one layer which is covered. But you're right, around two years ago, there's another startup company in Pakistan that had a data breach. And as soon as that happened, we became alert. We were like, okay, this is something that is happening. So there are hackers who are hacking data. So there are around 2 or 3 only companies in Pakistan who do a data security audit. So we instantly got that data security audit done, and we got a 97.9% security metrics in terms of the data. So alhamdulillah, the data is quite secure. I think when you're building an organization, when you're very new in your journey, if you are able to garner partners such as Microsoft, who are already very credible in the entire world, I think that really helps build a product which is really strong and which safeguards all the securities and data and everything.
All right, thank you. So another question for you is that, patient satisfaction with telemedicine. So do you measure this satisfaction through some kind of surveys? And, there is apprehension that if patient get diagnosis through telemedicine, there are sometimes misdiagnoses as well, or sometimes overdiagnosis as well. So does it happen in this last few years of your practice that some cases misdiagnosed through telemedicine or ended up in some kind of litigations or complications?
So Sehat Kahani or any other telemedicine company essentially caters to primary and secondary healthcare.
All right.
Same case with us. When a consultation starts, the patient gets a blurb that this is a primary and a secondary care service. If you still don't feel better, go to a physical physician. This does not replace the presence of a physical physician. Similarly, As I mentioned earlier as well, our doctors follow a triage system. So when they're asking questions, if they feel this is a patient who can't be treated on primary healthcare, through primary healthcare or through telemedicine, and who needs more advanced intervention, they refer the patient immediately. So again, from an organization point of view, we safeguard ourselves by writing that referral and sending it to the patient, so that as a company, we are safe that, okay, we have given the referral. And we have guided the patient that they are critical, they need to go to a physical space. So this is the second thing that we've done. We have, in Pakistan, it has been a bit of a challenge, but we have got in touch with an insurance company to have at least a basic minimum malpractice insurance, that in case any patient ever claims it, we should be able to give it to them. So we have recently gotten it done.
All right, that's great. So, just like telemedicine is in now, and there are a lot of artificial intelligence tools which are superimposing and helping to diagnose. So is there any kind of artificial intelligence app support in your systems which can help to quickly screen patient diagnosis, quickly screen this is perfectly normal and just need reassurance?
So right now, AI is not a part of it, but as you may have seen in the video as well, digital tools are a very important part of it, which help in the diagnosis. Machine learning is something that we have started to add. Now, what it does is that, for example, if I'm a patient and I'm constantly showing a high reading of blood pressure or hypertension into my application, during my checkups, what the application automatically will start to do is it'll start keeping a check on me that, okay, this is a patient which is red alert, who may need cardiac intervention. So they need preventive care measures right now. So things like, constant reminders that I need to cut down on certain foods, that I have to increase my mobility, constant reminders, and educational SMSs, notifications within the application for these kind of patients become active. Similarly, information goes to their doctor that, okay, this is a patient who may need, more cardiac intervention in the future. So how about start evaluating the different tests right now? So these are the kind of machine learning things that we have started to incorporate to focus on preventive care. I think AI is something which for Pakistan right now, it needs some time.
All right. Thank you so much for answering to my question. I can see one question by Santosh Kumar, which is a very interesting question, especially for finance management. Yeah, so what is the financial model of such telemedicine companies, and how much is the average ROI of good companies such as yours?
Yeah. So I think being an entrepreneur, I love talking about finance because we are always raising money in one form or the other. So the answer to your question is, we are a for-profit company. We have built the organization on a sustainable business model. For the clinical model that you just saw in the video, there are two models that we work on. Either we partner with the government, so the government is paying to us for our services, as you saw in this video, or we partner with private nurses, where we charge patients a certain fee, even if it's highly subsidized. If I talk about the clinical vertical only, within the clinics, we have to make 450 patients per clinic per month, so that the clinic is able to sustain itself on its unit structure. But the clinic doesn't sustain the entire organization. When I talk about the entire organization, the application, the mobile application, essentially is the more commercial part of our business, which helps us create revenues. Our major customers are corporates, as I mentioned in the presentation, which give us an annual monthly retainer based on the number of employees who are accessing our services, irrespective of the number of consultations that they do. So for example, if there's a company which has 1,000 employees and they're buying a package from me for their employees, which includes access to GP, specialists, and mental well-being, they will pay me an annual subscription amount for which I will give their employees unlimited access to these specialities. The interesting thing is, if you talk about ROI, we have a good 35 to 40% margin on our corporate financials. We have raised investment in the past. We have raised seed investment, pre-Series A. Now we are raising a Series A investment as well.
That's great. I hope that answer to your question, Santosh. Uh, I think that will be my last question if there is no question from audience. Currently in our audience, I can see that there are few faculty members who are working at medical schools and few are really at very high posts. So if we talk to establish telemedicine awareness or training for faculty members, and faculty members, they want to work at small setups like primary healthcare setups to establish telemedicine. So what do you suggest or guide that how to initiate it, and what should be the initiative point, and what should be the future perspectives they should keep in mind, which are very important before taking start and establish it?
At a telemedicine center?
Yes.
Yeah. So the interesting thing is, I was born and brought up in Saudi Arabia. I moved to Pakistan actually when I was 12. So one thing which Saudi Arabia very prominently has is a lot of very well-made infrastructure. So I think one thing that can be leveraged is creating infrastructure within cities or within places where the hospitals are at a farther distance. And those facilities can be converted into a telemedicine center. Normally, you don't require a lot of space. It's a 2-room space that you need. It's more like converting, 2 rooms into a clinic and a mini lab kind of, service. That's usually the model that we follow. So essentially, it includes having one employee who works as a supervisor within that clinic, and then getting a network of doctors who will be connected to this specific clinic during a certain time period. So a lot of those people who are associated with larger hospitals, tertiary care, groups, even those hospitals can create such, satellite clinics as their own offshoots, where those existing employed doctors of their hospitals can actually be rotated on a virtual basis.
Yeah, thank you so much. So thank you so much for sharing your experience. I think that is very much valuable, because the experience which you do in lifetime practice, that's not written in theories or books or anywhere else. So that's really very enlightening for us. Thank you very much for your time and efforts. And thank you all participants to join us today. So have a very good day. And recording of the session will be shared with all registered participants. Thank you so much.
Well, thank you so much. And I think what I'll do is I'll just write my email address also in the chat. So if anyone wants to have discussions or, any detailed conversations, so open to that. We want to bring Pahani into the MENA region, inshallah, in the next 12 months. So would love to see how we can scale this, within Saudi Arabia as well.
Sure. Thank you so much. Have a good day. Bye-bye.
Thank you so much.